welcome to another Wellness Wednesday Q&A here at the Paso del Norte Health Foundation Facebook page. I am Michael Kelly, Vice President of Programs for the Health Foundation, and as always, before we start, I encourage you to visit epcovid19.org. This is your information hub for the Paso del Norte region and was created by the Health Foundation to help the community, your loved ones, parents, students, businesses, mental health needs, lots of other information is there. And yes, there are learning resources for kids too. Today I'm here with nurses Jackie Vera, Jennifer Arreola, and Emily Hartmann, who is the Executive Director of PHIX, that is the Paso del Norte Health Information Exchange. PHIX is currently working to help recruit volunteers to be a workforce in response to COVID-19, and we call this effort EP Med. The EP MedCorps is a volunteer force, dedicated healthcare professionals are part of it, plus others who really care, who stand ready to support the El Paso community in the event of a healthcare crisis. So let's get started, and I encourage you to submit any questions early, and we'll try to get to them. So let's go in our little 15-minute session here first, I guess, to Jackie. And just tell us, Jackie, why was EP MedCorps created?
Sure. So EP MedCorps was established to help with the COVID-19 crisis response here in the El Paso region in case our healthcare system suffers a shortage of capacity in some way. And so a number of different partners in the community came together to help support this effort. The Paso del Norte Health Foundation, of course, Michael, is one of those key partners, the El Paso County Medical Society, Border RAC, and then PHIX, the organization that I run as well. PHIX on a day-to-day basis facilitates data sharing between health providers. So this is a new adventure for us, but we're really excited to be a part of this community effort to help with the COVID response.
Okay, so I guess Jackie really is our next question. Tell us, who can volunteer for EP MedCorps?
Anyone can volunteer. I think sometimes we hear the term hospital and we might think white coats and scrubs, but really it takes an entire team of individuals with different specialties to really give great and safe patient care. And volunteering is a great way to give back to your community when it's in a time of need. It offers an opportunity for you to kind of network, explore other interests, and really build some new skills. So anybody who has experience as a health care personnel, or even those that just really want to help their city, can volunteer.
So you don't need to be a doctor or a nurse to volunteer?
No, not necessarily. So we are trying to recruit physicians, nurses, phlebotomists, those personnel that do give direct patient care, but we are also looking for anyone with any kind of experience that that really wants to help out. So some really important roles in facilitating a location like this would be someone who can enter data, someone who can register patients. If you have experience with IT, that would be a huge help. Also, something as common as serving food, we really need help with the little things that make the hospital go round. And if you're a student who has clinical experience, you would be extremely helpful as well.
Wow, so there really are clinical and non-clinical volunteers, and both are needed.
Yes, if you want to help your city, we'll find a way to sign you up and get you helping.
Will the EP MedCorps be able to help really in a future crisis?
Oh, definitely. So this force was kind of created in response to the COVID pandemic. We wanted to be ready. So if you look at other surge facilities that appeared in other cities after disasters like Hurricane Katrina, they cite their key source to success as being ready. So not just the facility and the supplies, but having their staff ready to move into action. And so we're just trying to create this robust workflow of people who want to help their city so we can be ready to step in when that happens.
Okay. So let's move over to Jennifer. We'll come back to you in a minute, Jackie.
Okay.
Jennifer, what's been the response so far from volunteers?
Okay, right now we've had a great response. We have about 70 volunteers, and it ranges from the Bel Air School, Magnet School, so high school students. We also have Paul Foster School of Medicine. We have pharmacy from UTEP, nursing from UTEP.
we've had a great response from students. Like Jackie said, we are wanting more of the clinical staff, but these students are going to be a great asset to us. Their experience and their knowledge, their skills that they've learned in school is really going to help us.
Great, great, thanks. So Emily, Executive Director down here at our Health Information Exchange. First, before I ask you this question, just tell us a little bit, what is a Health Information Exchange and why are you doing this?
So a health information exchange facilitates your health record being available no matter where you go for care in our network. So we make sure that if you go to the hospitals of Providence, and let's say you are in an emergency situation, you're having a heart attack, the ED physicians there are looking up your health history. They're seeing what happened when you went to the UMC clinic, what happened when you went to your primary care physician, when you were at Texas Tech, so that they can best facilitate your care in a crisis, really. And so our role in general is to be a neutral facilitator of that data sharing across the community. And so we really fit into this as being a neutral facilitator of a volunteer workforce to help with the COVID-19 crisis as well.
Okay, okay. So remember to submit your questions early, and I'll look to our studio to see if there's any questions coming in. Now, Emily, tell us, how is partnering with the Paso del Norte Health Foundation help put the MedCorps together?
It's been key to the MedCorps coming together. The Health Foundation was part of the initial conversations on when it was just an idea that we might need a volunteer workforce. And then they really stepped up, you all really stepped up to bring the different partners together from PHIX, but also from the El Paso County Medical Society, from Border RAC, to kind of come behind this idea and make it happen. Of course, you all provided funding to help us bring Jackie and Jennifer in to do this work, which has been wonderful. They're a wealth of knowledge, which I'm sure you can tell by them talking with us today. So we really appreciate the partnership.
Okay. So let me ask you this. Somebody could be listening or hearing about this and they say, well, I'd like to volunteer. Maybe I'm clinical retired. Maybe I can do some data entry. But I want to put my name on that list in case things get really bad and I'm needed. How do they volunteer? I'm having a hard time hearing that.
It's EP at PHIXnetwork.org, or they can contact us at 915-242-0676. We also have social media pages in Twitter, Facebook, and Instagram, which are EP MedCorps.
And there's a link to sign up at each of those platforms.
And Jackie, could you just re-say those again? I'm hearing you a little bit better.
Sure. Sure. So our handle is EP MedCorps, and that's EP MEDCORPS, EP MedCorps, and we're on Facebook, Instagram, and Twitter. And if you'd like to sign up, we have a link at each of those websites.
Great, great. Well, thanks so much. Studio, do we have any questions at this point? None yet. Okay, that's fine with me. Tell me a little bit more about the non-clinical volunteers. I mean, I can put into my mind the kind of what a doctor may do or a nurse may do or a phlebotomist, but tell me a little bit about some of the non-clinical roles and how they're volunteering and who they are right now.
I think it's everything that happens behind the scenes. So everything from making sure that supplies get where they need to go, that patients know where they're going, family members know how to visit, laundry, food, everything that it's like building a whole new hospital in a new spot. So we definitely need all the help that we can get, both clinical and non-clinical.
Things like maintenance are very important. We want to keep the environment safe. We want to make sure there's nothing broken. Things like security too are paramount in keeping the facility secure. Anything you can think of, anybody that wants to volunteer, we can find a place for them to help out.
Mm-hmm. Oh, it sounds so nice. I mean, certainly we may need this for a surge in COVID-19. I could also see it being beneficial in kind of other crises events, kind of having this this list of people ready to volunteer. We only have a couple more minutes on the show today. Is there anything else you'd like to add, Jackie, Emily?
Please don't hesitate to reach out if you have any questions. I know it's a lot of information in a short amount of time, and everybody can offer, their different talents. And just go ahead and give us a call or send us an email, and we'll be happy to take any questions and really clarify.
Mm-hmm. Mm-hmm.
One question we get is about retired and out-of-state professionals, and we believe that there's opportunities for them to volunteer as well. So it would be wonderful, even if you stopped practicing medicine a couple years ago, by all means, give us a call. We can find a spot for you to be able to help.
Okay, all right. Well, we're wrapping it up here today. So I do want to encourage you to visit epcovid19.org. That is going to be your source of information for students, for businesses. There are links to various resources and learning materials for you. And make sure to look up EP Med Facebook page or other social media. And if you know somebody, please encourage them to sign up or consider it yourselves. Any parting words, our PHIX people, before we head out of here?
No, thanks so much for the opportunity and the partnership.
All right, we really appreciate you all. Have a good day, and thanks to Vera for helping us out here with our Facebook Live today.